Congressman Burgess here. It's Thursday morning, July the 23rd, 2009. This is the fourth day of our markup in the Committee on Energy and Commerce on what's called H.R. 3200, the bill that is going to change health care in America, where, again, the Committee on Energy and Commerce is the third and final committee that is going to do work on this bill before it comes to the House floor. So in just a few minutes, I'll be going inside the committee room. I'm going to ask you to join me while we get involved in the markup of this very important legislation. So here we are in the committee room on the Committee of Energy and Commerce. As you can see, we have the documents in front of us. We have the bill, the over 1,000-page bill that's been filed by the Democrats to change health care in America. We've also got the amendment that the chairman put out, another 1,000-page document, which is an amendment to the bill. I have my amendments. I have 50 amendments trying to improve this bill, or at least make it not so bad as it moves through committee. You know, people say that Republicans are holding up the process. Nothing can be further from the truth. I mean, I'm here ready to work. I don't like the bill. I don't like a lot of the concepts in the bill, but I think at least we ought to try to improve some things as it goes through the process. We've spent 2 days doing some of that. Most of the amendments that I offered were not made in order, but still, I think it's an obligation of everyone who sits on this committee to try to improve the bill as it goes through. After all, that's what the committee process is for. That's why we're here in the first place. So today is extremely important. We'll work on the bill. We'll work on the parts that are Medicare, parts that are Medicaid, the part that's to create this new public option plan, this new government-run insurance. And again, I've got amendments that I want to be recognized and I want to offer to the committee. So here we are in the committee, and we're ready to start. We can't change the bill if we don't meet in committee. What is the Speaker planning to do? Just simply bring this bill and the amendment and perhaps another amendment to the House floor next week with no one having read it or understanding what's in it? Is that what we're going to be asked to do yet again? The American people are so mad at us for not looking through these things and understanding what's in these bills. Page 16 of this bill, if you like what you have, you can keep it unless we tell you you can't. 425 of this bill, we're going to be doing some things in Medicare for end-of-life care that some people might find objectionable. We're not going to have the chance to mark these things up, to change these things, to improve them in committee if it just goes straight to the House floor. So let's go see if we can talk to the chairman, and let's see if we can find out what's going on. I'm going to talk to Mr. Waxman. He's the chairman of the committee. Maybe he can help me understand why we're not meeting here today to mark up this very important bill. Mr. Chairman, health markup has been postponed. It's going to be hard to work on this bill if we don't get together in committee to do the work. Remember, it's not Republicans who are obstructing this bill. The Democrats control the House, the Senate, and the White House. They could pass any bill they want without any Republican input. The fact of the matter is the bill is so bad that they're having an argument with themselves, and right now it looks like they're losing.